I'm Patty Glatfelter, and I'm a retired physical therapist. I'm 62 years old, and I've had multiple sclerosis for 25 years. I've kind of been around the block with different kinds of treatments. I've experimented on myself. I know what's worked and what hasn't worked. But the thing that I didn't realize in the last year was that things went awry, and I just decided that it was all because of MS. So the pain got worse, my walking got worse, my ability to function got worse. But I just kept thinking, oh, just plug on, carry on, you'll make it through. And finally I reached a point where I was like having to give up all the stuff that I really liked to do because it was so uncomfortable and my gait was so limited. So I saw that Justine was opening a practice with the myofascial release component, which I felt probably was something that I really needed. It was something I couldn't do for myself, and it was something that I didn't feel like massage therapy was going to do either, because I needed to be looked at as a total package. And so seeing Justine has really helped me to do that, because I can work with her. She works some of the hands-on physical stuff that myofascial release provides, and then points out those areas that I can carry on with myself. And she picked out things that, believe me, I had no idea were going on. And I needed that outside pair of eyes and that outside pair of hands to educate me, even though after 40 years as a physical therapist, I really thought I pretty much knew all there was to know about PT. So, you know, it was amazing that within 2 visits, my pain went from like what kind of averaged 6, sometimes 8 out of 10, down to 2 out of 3 after 2 visits. And it was pain in my knee, my hip, my neck that I really thought I was going to live with. That was just what I was going to have to tough it out. So to get that much change in that brief of a treatment plan was mind-blowing for me. And so, of course, that made me want to work more at home, to think more about what I was doing that helped be a positive or a negative for how I was doing. And I got the kind of encouragement that I needed, that it was like, okay, now you can move forward. This is what you can do. And oh, did you notice this? Because there's a lot of stuff that I think people in pain just kind of, they blow past. They think, you know, I'm just going to ignore that. Or they're not even aware that it is existing in their body. And I think myofascial release is a treatment approach that really addresses those issues, rather than just, you know, this is your range of motion, this is your weak muscle, do this exercise, here's your 5 exercises, do them 3 times a day. Sometimes that just doesn't cut it. Sometimes it works fine. But I think when you've had pain over time, maybe there's neurological issues, I had balance issues that have improved. I've had strength that like spontaneously really improved because of the myofascial release. And it wasn't just pure, okay, let's do 30 repetitions of an exercise. And I don't think a lot of times we really look at those issues. So I can't say enough about how I think the Justine's approach with using myofascial release and her excellent skills as a PT can make a huge difference in somebody's function and pain level, and in a relatively short period of time, which was, I think, one of the most surprising parts of it too. It was really an investment in myself to come and get treatment, and that was a hard thing for me to come to terms with, because I thought I could do it by myself, but there's a lot to be learned even after years of experience. So.
Can you tell me a little bit about the activities that you were struggling with before you started therapy, and how that's improved now?
Absolutely. Before I started PT with Justine, I struggled going up my 1 flight of 12 stairs using my 2 handrails. And I would minimize the number of times I go up and down in the house because of the pain that I was experiencing in the hip and knee, and because my balance was so bad. I was bouncing a little on and off the walls sometimes, just going down a straight hallway. So that has changed radically because, you know, like 6 weeks after starting treatment, I walk, you know, easily a quarter mile without feeling like, whoa, I'm gonna lose it, I'm gonna fall. I can get up and down from the floor easier, which was a huge struggle before I started treatment. I sleep better. My medication has decreased that I was taking for the pain at night, and I can actually feel the smoothness of my gait and my movement. I just feel more coordinated, and it makes you want to do more because you're more coordinated and because everything isn't a struggle. So that's some of the most significant changes, plus my flexibility. Things that I had been trying to stretch religiously for 6 months and was really not getting anywhere. I felt it was all spasticity, and because of the myofascial release and the consistency of looking how to approach it, my flexibility is almost back to normal, which, you know, I was never a really loosey-goosey person. So to get to a point where I just feel like I could fit in with an average crowd has been pretty fantastic.
Good. Do you feel like you're a little safer because of your balance and your walking?
Oh, absolutely. I'm so much safer walking. The reason I think that all this process started was from a fall in the garage 6 months ago. But I was falling probably at least every couple, 3 weeks before I started treatment. I haven't even had the slightest sense that I was going to fall in the last 6 weeks. And so that's huge. And when I first came to PT, my balance on one leg was, on my best leg, was only 3 or 4 seconds. On the bad leg, I couldn't really balance. It was cling to the table. And now, you know, I can see improvement almost on a daily basis.
Okay, great. Would you mind showing us a little bit on what you can do now?
Sure.
Okay.
I can do that. So some of the things that I've improved on is when I first started, I would squat about like this, and if I had to get something from the floor, I had to hold on to the furniture, and I couldn't hardly get to it. I used a long-handled reacher a lot. In the last 6 weeks, I've gone from that to being able to do this and have it not hurt and be able to recover with no problem. When I started, before I started PT, my gait was more like this, and I really had to think about every single step, and now I can walk smoothly. I can pivot. I don't have to hold on to the wall or a piece of furniture. I can kick, which I wouldn't have even considered doing that before I started PT. I can kick with either leg. I can stand. This is my good leg. This is as good as it gets, folks. But I can do it without touching furniture, which was impossible before. My not so great leg, I don't like to use the word bad, but I can now do that. And I would not have even been able to approach that before I started treatment. And the stretching, I mean, I can stretch now comfortably. That kind of a calf stretch just killed me in this leg before I started PT. Now, it's like, it feels like it should feel when you're stretching. A little stretch, but not miserable. Picking my legs up, could not march. Before I started treatment, that was the kind of march step I could get, and this one, maybe that, but I'd have to sit down for every shoe or sock I put on, and now I can function a little bit with just putting a shoe on, just touching a piece of furniture. So